Do you leave every doctor's appointment with more prescriptions and referrals and also more questions? Oh, friend, you're in the right place. I'm Kayla, registered nurse and personal medical strategist, and here every week we're going to work together to cut through the noise, connect the dots, and finally get you the real plan you deserve. Let's dive in. Hi, welcome back to episode 2 of Scripts and Referrals. Thank you for coming on back to hang out with me. Of course, as a brief recap, the first episode was all about the factors that are contributing to the creation of this medical merry-go-round, where you're kind of bouncing from doctor to doctor, test to test, medication to medication, but never really getting to the root of it or getting answers. As promised, today is going to walk you through the framework that I use with my clients to help stop that spin cycle and find the exit path. Because, as we talked about in episode 1, the American healthcare system is structured in a very fragmented and siloed way. And unfortunately, um, patients, individuals themselves, just like you, are shouldered with a lot more of the burden of responsibility of coordinating their care than most people realize. Um, by and large, it's unfortunately pretty safe to assume that nobody is coordinating things behind the scenes between all these specialists on your behalf. And I just want to take a pause and say that is wildly unfair and absolutely ridiculous that patients have this burden of care coordination. And, I guess it's not always necessarily required. You can kind of sometimes you can get by without it, especially again if you have common conditions. But my medical misfits, I like to lovingly refer to, I use that phrase of people who, the system hasn't quite figured out what's wrong with them yet. Like something is definitely wrong, but all the tests are coming back normal. Sound familiar? So the system in particular is not set up for those of you like that. But that's okay. There is hope because I have a process. So, the process that I follow with my clients to again stop the spin and get a clear path forward and get results, I call the restorative care process. It's a 5-part framework, and it's something that we kind of rinse and repeat and keep going through to help guide our care, and get us to that outcome where we're trying to get to, typically a diagnosis and a treatment plan that returns somebody back to health. That's why it's called the restorative care process. This is in direct contrast to the reactive and fragmented methods. Methods that the healthcare system employs isn't even the right phrase because that implies that there's some intentionality behind it. And really, what we're seeing here with these gaps in care is actually a lack of coordination and intentionality. But, anyways, this is the antidote. So, the restorative care process is a 5-part framework, and it goes around kind of in a circle. As I mentioned, once we complete one piece, we go back up at the top and start again. So, step 1 is assess. This is where we kind of stop everything and lay it all out, start to finish. And think of, you ever watch those movies where there's an investigator on the trail and they've got newspaper clippings and like red string all over the wall? We don't necessarily need to get all the way to a full wall size corkboard, but the idea here is the same. We want to take out all of the pieces of history and lay it all out because that is the only way that we are going to get to step 2, which is discovery. Finding the missing pieces where the ball has been dropped, where something has been forgotten. This is the way we expose the gaps, the things that, somebody said, oh, we should follow up with this test, but then it wasn't ordered. All of that kind of stuff. Finding the gaps and cracks is the discovery piece here in step 2, but it relies upon first laying it all out. These pieces are they work very closely together, which is why I kind of talked about them at the same time. Now, I want to pause and say that I know that what I presented just now can sound overwhelming, and I am sorry. I really wish that there was an easier way, and believe me, if I can figure out an easier way, I will be implementing it and I will come back on here and share it with you. But as it stands right now, this is the process that I have found actually works, and I haven't found a shortcut. So, that being said, what are some steps that you can take to implement this and stay out of overwhelm? So, for that assessment piece, again, we're not going for the detective on the wall straight out of the gate, right? But the first thing you can do is start to gather your records, particularly if they are across multiple health portals or multiple hospital systems. That once you start crossing over into other portals and systems is where we really get into a territory that is prone to gaps and cracks in your care plan. Um, a lot of times people believe that doctors are coordinating and communicating together, or another belief that I've heard often over my career is patients saying something along the lines of, oh, well, that should be in my portal. But here's the thing you probably have had some experience with. These health portals are, by and large, not set up very intuitively. So tell me if this resonates with you. Have you ever gone into your health portal and you just get overwhelmed with like lots of data, but you find it difficult to even find what you're looking for? Yeah, it's not better on the provider side. In fact, I dare say it's even more challenging because there's way more data on the provider side than there actually is on the patient-facing side. And the bulk of your providers do not consider themselves to be technologically inclined people. They're oftentimes kind of forced into using this system that they hate and don't know all the ins and outs of. So, all of that to say, number one, if you take nothing else from this episode, know this: never say it should be in my chart. Always assume that somebody is not going to find information in your chart and you need to be prepared to have it for yourself. Number two, taking this a step further with the assessment piece of the restorative care process, gather all of your records so that you can have them in your possession in your own place. Start with procedure reports, radiology results, so CAT scans, MRIs, X-rays, and lab results. Those pieces of data will be a really great starting point. Bonus points if you want to start getting into digging out office notes as well. Although, be warned, if you haven't looked at them before, they do tend to be rather bloated, in my opinion. If you look at the whole thing, there's probably like 80% of it that's not even helpful to you. But start there. Do as much as doesn't feel overwhelming for you. Then, once you get the records pulled, start going through them and looking for those pieces that don't have an answer yet. What do I mean by that? For instance, perhaps you had a lab result that was out of range and it didn't get talked about yet in a medical appointment and you don't have an explanation for it. That's a red flag or maybe a yellow flag. Either way, highlight it. That's one of the pieces that we're going to follow up on. So keep finding stuff like that. Another really great piece of this discovery portion is taking the time to sit down and making a catalog of all of your symptoms, whether or not you think they're important, whether or not you think they're connected. Newsflash, almost everything is connected. You have medical problems that while it may be affecting one body system, the whole body is an ecosystem. Now that kind of flies in the face of the way that medicine is approached in healthcare today, and I think that's a huge flaw. But all of these systems are working together. The heart impacts the kidneys, impacts the lungs, impacts the brain, and we have to stop looking at them all so in their small little pieces of pie. So, to recap, the assessment and discovery pieces, the pieces that I want you to take action on today, or at least put it on your calendar to make some time for gathering your records, combing through them for what has been overlooked, not followed up on, etc., and a symptom log. From there, these little pieces and patterns can start to emerge. That, when I work with my clients, is what guides the third step of the restorative care process, which is strategy. Having a strategy for making sense of all of those parts and letting that guide our healthcare journey moving forward is absolutely critical. Without strategic guidance on that journey, we stay in the reactive and fragmented nature that keeps us on this medical merry-go-round, because that really just becomes a trial and error process. This is why, for so many people with complex chronic health conditions, it can take, on average, 7 years to get a diagnosis. The fragmented and reactive approach to healthcare is exactly what keeps people stuck in this medical merry-go-round. It's a trial and error approach. We need to shift into this strategic approach to identifying the current gaps in the plan and targeting a path for those specific things. Now, I just want to say, I realize that this piece starts to get a little bit more technical. And I also want to pause and let you know that, as I'm sure you can tell, there is a lot more to each of these steps than the little bit that I have shared. This episode is kind of a high level approach to the entire process. As the podcast goes on, I'm actually going to do a bit more of a deep dive on each area of this to give you even more to work with. But right now, let's kind of start at the top. So we've got the assess and discover. We're going to pull together those pieces of our medical history and start to highlight the gaps, the unexplained, the unresolved. Then strategy is how in making the plan for how we're going to address those unresolved pieces. This does get a little bit more sticky and technical when working without a medical background. Now, of course, we have tools at our disposal. So for the longest time, the biggest tool at our disposal has been Google or WebMD. It was was pretty hot for a while. And now we have AI. Word of caution, AI, when used in this way, is, a bit more of a detailed, kind of nuanced search engine. You can dump symptoms in and it can spit out possibilities. This can be helpful for dredging up possibilities. However, where that falls, what I have found when trying to utilize AI in this way is that it's helpful as a research tool, but it doesn't have the clinical insight to be able to bridge that gap of, if this fits in your clinical condition based on all of the nuance that is around you medically. I have to say, I did not understand, a decade ago when I was getting into healthcare, how much nuance is in practicing medicine. They joke that that's why it's called practicing medicine. It's so not black and white. It truly is 10,000 shades of gray. And it takes, especially for complicated situations, it takes an experienced clinician to be able to kind of weave that thread and understand that nuance. Now, all of that considered, there are still some steps you can take to start putting some strategy around your healthcare journey. My recommendation when you're just starting out in this new role and embracing the strategic nature is to pick the one thing that stands out to you the most from that assess and discovery process, and make that your top priority at your next appointment. Now, a couple of things about that. Appointment preparation is critical. In the next episode, I'm going to talk about how to maximize your appointments and truly how to get your doctor to listen to you. It's one of my favorite topics. So be sure to come back for that. However, one of the biggest takeaways I'll give you now is pick one thing. You notice I said pick one thing to talk about, not seven things, not all of the things, one thing, because those appointments tend to be on average, a medical appointment in America is 17 minutes. And that is not a lot of time. And if you give your provider five things that you're concerned about, their attention is going to be divided five different ways. And, it's kind of like think about putting icing on a cinnamon roll. Like you can take, if you only have a little bit of icing, you can spread it thin all the way around the top and just get a tiny little bit of sweetness, or you can glob it in one place and take one bite. That's the approach that we want to take here. It is better to get one good bite to move your situation forward as opposed to trying to spread the approach across all areas and really not getting anywhere with any of it. Maybe that cinnamon roll analogy wasn't the best because let's just make more icing, but it was the only thing that came to mind. Bear with me. Hopefully, my metaphors will get better as I get back into podcasting. Okay, so we talked about the strategy, pick the one thing and how you're going to approach it in your next appointment. Step 4 of the restorative care process is action. There are steps we need to take to get from point A to point B. So action basically is taking our strategy and getting it done. I want you to take one step today that you've been putting off. Maybe it's booking that overdue follow-up or chasing down those lab results that it's probably going to take 5 phone calls and a headache. Get it done. Pick the thing that you've been putting off and get it done. Step 5 is adjust. So this is the completion of the process where, again, I do this with all of my clients, typically on a monthly basis, where we look at the plan, we talk about those actions, reflect on those action steps, figure out, okay, what worked, what didn't, what new pieces of data do we have, and then we kind of make the plan all over again. This is why I say the cycle goes round and round. Unlike the medical merry-go-round, we're going to go around on this side. So how you can apply this today to your own healthcare journey. After every appointment, I want you to ask yourself and write down the answers to these 2 questions. What did I get clarity on? And what's still missing? This will help you to go back to your sequence that you've put out already and identify your next action steps to take. So I know this was a lot. I've trimmed it down to as brief as I can for taking some steps today and start to get some clarity. You know what? Let me recap that for you. So I want you to get your records together in one place. If that feels overwhelming, just start with one aspect of your records, such as test results, blood work, procedures. Step 2, write down all of your symptoms that don't yet have answers, and all of the unusual things that came up in your record harvest that don't yet have answers. Step 3, find your priority action item and work on addressing just that priority at your next appointment. Step 4, take one step today that you've been putting off. And step 5, after that next appointment where you discuss that priority item, I want you to ask yourself what you got clarity on and what's still missing. Just by beginning to implement this simple framework, you will find over time that you start to get things moving in the right direction and you don't feel like you're caught in a washing machine on these appointments anymore. It's very empowering to start to take control back of your healthcare journey, even in the beginning when you're not getting the results that you haven't got the results yet that you're looking for. Taking the steps and taking back that control feels so good. Make sure you come back to episode 3, where again, we'll be talking about how to get your doctor to listen to you. Thank you so much. Have a wonderful day. Don't you go to another appointment unprepared. Head on over to herdforlife.com/guide and get my free doctor's appointment prep guide so you can start getting the answers you need and get off the medical merry-go-round. I'll see you next week.